Yeah, for women that don't take folic acid, this is what could happen if you don't take folic acid. Folic acid is very essential in pregnancy. In fact, is the fuel of pregnancy. Is the petrol. You know, petrol is very important in Nigeria, right? Is the petrol of pregnancy. Eh? So, is the subsidy of pregnancy. Folic acid is the subsidy of pregnancy. It's what sustains pregnancy. It's what gives life to pregnancy. So don't joke with folic acid. You see that small drug, not taking it can cause you a lot of trouble, can cause you a lot of stress, can cause you and your baby a lot of stress. Don't joke with that drug. If you don't take folic acid, the brain of your baby will not be developed. So that's where you will now have a child. They will tell you that during ultrasound scan, they will tell you that the brain was not formed. Anencephaly. That's what they call it. You can see the pictures are up here, right? Anencephaly. The brain will not be developed. That's one. And during scan, it can be picked during scan, right? And they will tell you that the baby has frog eye or the baby has bull eye. Yes, bull eye, right? That is anencephaly. The baby's head will be flat. You can see it up there. The baby's head will be flat. And that such babies do not survive. Even when you give birth to them, they die. That birth defect is a birth defect where anencephaly, cephalos means brain, right? Anencephaly, ane means no, no. So no brain formed. That's what anencephaly means. No brain formed. No brain formed. So you may end up having a child with anencephaly if you don't take folic acid. You must take that folic acid. You must take it. Whether you are vomiting, whether you don't have appetite, whether it's smelling in your nose, it's not an excuse. You are a mother. Eh? You are a mother. You should pay. You want to bring a child to life, and the child you are bringing to life should be healthy enough. It's your responsibility, right? It's your responsibility. So that's an encephaly. And such babies, if you give birth to them, they die. They die in the first 24 hours of life. They die because there is no brain. It's just brain stem. They will be able to move their body, but they die because the whole brain is not formed. And even they see they will not survive. They will not survive. They die. Now another problem you may have, right, when you don't take folic acid that may affect your baby, right, is spinal bifida. Spinal bifida. There will be a hole in the spine of the at the back of the baby, and the spinal cord will be exposed, draining water. Spinal bifida. Some women that have given birth to a child with spinal bifida will tell you what they went through. They will tell you what they. I'm very practical. Mm. Even people that know me online, people that know me physically, they know me for one thing. And people that have spoken with me before through online consultation and the rest, they will tell you that one thing about me, that I'm very practical. I don't know how to bend things to suit you. I have to just tell you the truth. That's my job. That's my duty. My job is to tell you the truth and not hide any truth from you so that you can now make informed decision. Right? I'm very practical. Women that have had children with spinal bifida, if they tell you the stress they went through, sometimes they lose the child, and even when the child survives, they go through a lot. Sometimes the child is born paralyzed with spinal bifida, born paralyzed. Sometimes the child will not have meningitis because infection will spread through that hole in the back to the brain. So the child will have meningitis. I'm taking my time to explain these things to you so that you know, when you hear this thing, you will know that you need to take your folic acid serious, right? You must take it serious. So spinal bifida is a big deal. Some children with spinal. I don't want to put the pictures here because it's somehow discriminatory of paralyzed children that had spinal bifida. They were born with spinal bifida because of folic acid deficiency in their mothers, right? They were born with spinal bifida. You will see them on wheelchair. You can Google that yourself. You will see them, right? I don't want to put pictures that will sound discriminatory or cause psychological harm to anybody. Another thing that can happen when you don't take folic acid is that the child may have a hole in the skull. right? A hole in the skull. When all those meningocele, eh? Meningocele, all those are big words. Eh? What that simply means is that the brain is the brain pushed out because of the hole in the skull. The brain is pushing out through it's exposed. It's pushing out through the skull, and it's exposed. Sometimes it's just the covering of the brain. Sometimes it's the whole brain, and that is pushing out through the hole in the skull. Those are very terrible things that can happen when you don't take folic acid. So I said, let me let you know, let me update you. It's very important I update you. You must know these things so that you can prepare your mind, so that you can take folic. Because some people are still saying they are 4 months now, they have not been taking folic acid. Why? Why are you not taking folic acid? You don't even need a doctor to prescribe it. That's why folic acid is an over-the-counter drug all over the world. As soon as you are planning to conceive or you are pregnant, immediately you start taking folic acid. That's why people that I always ask, are you on folic acid? Take folic acid. Don't joke with it. Oh. It's not a joke. It's a very serious matter we are discussing here. If you want your child to be intelligent in school, to do well, to be able to compete among his or her peers, you have to take responsibility now. One of the responsibility you need to take is by taking folic acid, right? By taking folic acid. There are some women, because of they have serious vomiting, they were vomiting in pregnancy, the vomiting was so severe they were not able to take folic acid. They get affected. They start having, they will have a child with spinal bifida, right? Because they were vomiting the folic acid. So any vomiting you are having, especially if you are vomiting 6, 8 times in a day, go to the hospital so that you'll be admitted, so that this vomiting can stop, so that you can take your folic acid. I know that they said this folic acid smells to the nose. I know, but you have to take responsibility. Just as it's my responsibility to tell you all these things. I've seen terrible things, especially when it comes to children. Huh? It's not it's not funny. Um, it's not easy to give birth and you continue. The child is already sick. You know what it means? You give birth to a child and the child is already sick. You are running from one hospital to the other, the child is admitted. I don't want it. That's why I tell you to eat, because I don't want your child to have low birth weight, right? Low birth weight is one of the worst things that can happen to a baby, right? I don't want to have your child to have low birth. I don't want your child to have any birth defect arising from folic acid or alcohol intake or agbo ever use. Thank you and bye bye. Before I go, don't forget to subscribe to my YouTube channel. The name of my YouTube channel is Nigeria Health TV. The link is in your bio, in my bio. Subscribe and also watch videos on my YouTube. Thank you. Bye bye.